so we're going to, in this video, demonstrate breathing and coughing techniques. Some of the first breathing techniques can be done either in standing or sitting. So what we're going to do is we're going to show you how to use your posture to kind of facilitate specifically inhalation, but you can also use it for exhalation. So first of all, it'll be, head movement, scapular and shoulder movement, and then just shoulder movement, and you can also incorporate them together. So breathing in, you can add cervical extension like this, and breathe out like that. You'll see this in yoga positions, and it just kind of helps to open things up. Same with scapular retraction, like so. And then you can also do shoulder flexion. So naturally, you kind of want to add that cervical extension with those, and I feel like it opens things up pretty nicely. Another thing you can do is using your PNF diagonals. So you can go open, breathing in, and closing, breathing out. Like that, okay? So again, just working in those things. You can do both sides. One side really is up to you, how you feel works best. If you have one side that's more affected, you can go to that side. Another way to do that kind of bilaterally, similar but different, is called the butterfly technique. So hands behind the head, open up, breathing in, and closing, breathing out. So notice I'm kind of flexing too in my abdominals, kind of forcing that air out, okay? So thankfully, I have a volunteer. His name is Salam the Sloth, and he is going to help us out today. Notice he has some pretty poor posture, kind of rounded shoulders forward. So we're going to try to help open him up, okay? So he looks like he's finished his morning coffee. We're going to show you how to use a towel roll. We're going to have this, it's going to be parallel with the spine, right over the thoracic spine there. We're going to have him lay supine over that. Okay, so we're going to have him lay just like so. And this is going to really open up that chest, okay? And it's also a nice pec stretch. So often we'll have forward shoulders, tight pecs. This will help stretch that out. You can add a little overpressure, but some people, it's kind of uncomfortable. You can also do this with a foam roller, which can be even more uncomfortable, so you might want to pad it with a towel, or just use a towel roll to start. So you can also practice diaphragmatic breathing with this, but that may be a little much on the first try. But so how you would do that is kind of instruct them to keep their upper chest still while breathing in, while pushing out with their stomach. Okay, so we're kind of breathing in, push against my hand here. Good, and breathe out. And down, good. In, and breathe out. Good. And you can also have them kind of breathe and push against your hands here. So kind of some more manual cues there. So breathing in, push against my hands, good, and out. Just really encouraging the lower costal region to move with the breathing, okay? So this is a good place to start before having them sitting or standing. You can also have them do it themselves, so they can have their hands here without the towel roll, because that might be a little much for them. So kind of hands on their stomach, breathing in, feeling that lower costal region going up, breathing out, feel it go down, okay? So we don't want you shrugging your shoulders and using your upper chest. We want you to use your abdominals, okay? So next, we're going to show you how to add a towel roll perpendicularly, so in side line. So we're going to have it the other way, perpendicular where it was. we're gonna have them roll on top of it so that it's underneath them while they're laying on their side, okay? So using this technique, we're opening up the side that's up. So we're gonna have them you can kind of have their hand there. It might be a little bit more comfortable like that. You're kind of opening this up. You can also do a myofascial release here, okay? So kind of doing myofascial release. You can do maybe some mobilizations here. Again, it might not be the most comfortable, so just gauge where your patient's at, okay? So have them roll back, move the towel roll out of the way. Another thing while they're laying here, you can have them flip over to prone. Now he might be uncomfortable because we noticed his posture was pretty kyphotic, so we might need to add a pillow, okay? So we'll have him roll to his stomach. Might need a pillow or something. This might be a little bit too big, but that's okay. So see here, he's kind of struggling, so we might need to help him, okay? I wouldn't advise you really putting a lot of pressure on your patient's head, but this is an extenuating circumstance. So have them kind of prop on their elbows, and again, cervical extension with breathing in, okay? So breathing in, extending up, good, and breathing out, kind of going down, okay? So kind of propping on those elbows really helps to open things up, okay? Here we go, breathing in and breathing out. Good, okay, so that's everything while laying down, so we can have him sit up, good. And while he's sitting up, we can do some thoracic vertebrae mobilizations, we can do some rib mobilizations, we could do a myofascial release here as well, like we did in side lying. Another thing that we can do is specifically for exhalation. It's called pursed lip breathing. So I'm going to demonstrate, okay, and then I'll have you do it, okay? So pursed lip breathing, breathing in through your nose, breathing out through those pursed lips, kind of like you're going to whistle, but you don't actually whistle. What you're doing is you're increasing the pressure during expiration, and it kind of helps you use your abdominal muscles to force the air out, because it's not coming out very well passively like it should, okay? So I'll have him do that, but I'm actually gonna incorporate paced breathing with you, okay? So I'm gonna have you breathe in for 2 seconds through your nose, and then breathe out for 4 seconds through your mouth, okay? So I'll count for you. So breathe in, 1, 2, breathe out. 1, 2, 3, 4. Good, good. He's doing great. Okay, well, in the next video, we're gonna do coughing techniques, because he seemed to have a little trouble with that during our evaluation, okay? So we'll see you back in just a little bit.